Hi everyone, welcome to our event. My name is Dr. Frankie. I am a practicing doctor. I actually work in oncology. I do kidney and bladder cancer, but on social media, my handle is at Dr. Frankie JS. I talk a lot about women's health. I am a 30-year-old woman, so I relate with a lot of you. And I think it's so important that doctors have a voice on social media so that when you go to social media, you have, evidence-based, accurate information there to support you. And I'm so pleased to be involved with Fann Summers on their Remove the Fear from the Smear campaign. They've sent me something really exciting, which you'll have to head over to Instagram to see. It's called the Life-Saving One, and the theme is all about cervical cancer screening. Now, you might be aware somewhat about the NHS cervical cancer screening programme. Sorry, someone's having some issues with hearing. Can everyone else hear me? There's just a chat.
I can hear you.
Great. Okay, perfect. I'll continue. I hope that Sasha gets her sound sorted. So you'll be somewhat aware of the NHS cervical cancer screening programme, and I'm just going to summarise a little bit about what that is and what it does, and then we're going to delve straight into some of your questions that you've submitted. There's some excellent questions on there and some really different ones, so I'm really excited to answer them for you. So the NHS offers cervical cancer screening, and it's between the ages of 25 to 64, and it's at varying time points depending on where you are in the UK. In England, women between 25 and 49 are invited to have their cervical cancer screening every 3 years. And then from the ages of 50 to 64, it goes to every 5 years. I know different parts of the UK, it's done in Scotland, for example, every 5 years. Now, there is nearly 3,000 cases of cervical cancer diagnosed each year in the UK, 2,700 to be exact. And something I'm so passionate about is that over 99% of these cases are preventable with consistent cervical screening. So if we're attending our cervical screening, we can massively reduce our risk of developing cervical cancer. The numbers are quite high, and actually 1/3 of women will lose their lives to cervical cancer, and 83% of cervical cancer deaths can be prevented with cervical screening. Now, you might be asking why I'm calling it cervical screening. You might have heard it called the smear test, and actually they're the exact same thing. The smear test is just the old name for it. Just to briefly explain what we do, the cervical screening is where you have a speculum examination, and the health practitioner will have a look at your cervix and then take a small brushing sample of it. Now, what they do is they first test for a virus called human papillomavirus, HPV. And that's because this virus is responsible for over 99% of cases of cervical cancer. So they test your sample for HPV, and if it's positive, then they'll test the cells of your cervix. And if it's negative, then they won't test the cells. Historically, it was called the smear test because we would just take cells straight away, smear them onto a glass slide, and then send them off to the laboratory for testing. Now, something that's really interesting about HPV is that most people get HPV at some point in their lives. So it's spread by sexual activity, but it's not a sexually transmitted infection as such. It's a virus that pretty much all of us are going to get, but most of us clear it naturally. Our immune system just gets rid of it, and we don't even know we've had it, and we don't have any problems. Some people catch a high-risk strain of HPV or have slightly different immune systems, which means they don't clear it within a couple of years. And it can cause changes to cervical cells that over time, around a 5-year period, can develop into cancer. And so when we're doing a cervical screening test, we're testing for HPV and abnormal cells before they turn to cancer. So it's not a test for cancer. Now, there was lots of awareness about cervical screening when Jade Goody unfortunately died from the disease. And during that time, there was a boom and people were really consistent and compliant with going to the cervical screening. But since then, we've actually seen a decline, with 1/3 of us not attending our cervical screening regularly. And I really hope that from this discussion, having some of your questions answered will remove the fear and address some of the barriers you may be having to booking your smear test and going for that. So if it's okay with you guys, I'm going to delve straight into your questions because I'm aware of time and there is just so much I want to answer for you. So the first question we had is probably the most common question that everyone asks. Will the cervical screening hurt? Now, when you have your cervical screening, what happens is you have a speculum inserted into your vagina and they have a look at the cervix and take a small brushing of the cells. Now, the speculum, I wish I had it with me, is no bigger than a sex toy. It's actually quite small. It's about this big, and they open it up to have a look at the cervix. They can use lubricating gel, so it should go in quite easily. And it, in general, might be uncomfortable because you're a little bit anxious and everything's a bit tense, but it shouldn't hurt. And the practitioners that are doing these procedures honestly do hundreds of these each month. So they're really well equipped to doing it quickly. I had my smear test done in October and it was honestly over within a minute. I was in and out of the room within 3 minutes. I timed it to make some social media content. Some people, however, have a particularly bad experience. They might have a condition such as vaginismus, which is basically where the muscles inside the vagina can contract abnormally and kind of spasm, and it's a subconscious thing, and that can mean it's a little bit more difficult. Some women may have had a previous bad experience and be particularly anxious anticipating the test, and it can mean that all the muscles are a little bit tighter and you're a bit less relaxed. And some people might have had sort of personal history of trauma or a bad sexual experience, which means they dread this test. Now, if you're someone that is has had a previous bad experience or you have any of the conditions mentioned, then there's a couple of things you can do to make it a bit more comfortable. The first is that sharing your concerns with the practitioner before you go. So you can book a double appointment so you have a bit more time. You can share that you're anxious or you find it a bit painful and they can talk you through it as they're doing it, or they can do it a bit more quickly or a bit more slowly depending on your preference. You can also actually request a double appointment. I think I mentioned that. And you can also ask for the first appointment of the day. And that means you're not waiting in the waiting room for as long. I know that sitting there anticipating the test, sitting in the waiting room is often where our anxiety gets the better of us. You can also ask for a smaller speculum. So we use a standard size, but the procedure can be done with a smaller one. Ask for more lubricating gel. You can even ask to insert the speculum yourself if that makes you feel more comfortable. And something I quite like to do is take some painkillers before, not because it's particularly painful, but it just makes me feel a little bit better that I've done it. Someone's just asked in the chat that is anything that can be done to help with the scraping feeling. Now, that's a really individual sensation. They actually don't do a scrape. What they do is they insert a really tiny little bristle brush and they just kind of like swirl it around the cervix a little bit. So you can get an uncomfortable sensation, but it shouldn't feel like a scraping. The scraping aspect of the test comes later if you have abnormal cells detected and they invite you back for something called a colposcopy, which is entirely different, and that's actually to remove the abnormal cells. If you're someone who finds it particularly uncomfortable, for example, you've noticed it feels more scraping sort of sensation, you can take some painkillers and just kind of mention that to the practitioner just so they can do that bit really quickly. For most people, I just want to reiterate, this really is not as bad as you expect it to be, and it's over within seconds. And when you kind of understand the life-saving benefits of doing this, for me, it makes that few minutes of a little bit of discomfort completely worth it. A second question we had is, can you have sex before and after the cervical screening? Absolutely. There's no reason that you can't. Sometimes people might have a little bit of discomfort during the procedure and they might feel a little bit tender and you might just want to go easy afterwards. And some women might actually bleed after the cervical screening. Now, that's completely normal. And it's actually very common if you take hormonal contraception, such as the combined oral contraceptive pill. That's because you can develop something called an ectropion, which is basically where some of the cells that line the womb actually appear on the outside of the cervix. And they're very fragile. It's nothing to worry about. It's nothing abnormal. But what it means is if they're touched through the screening, they might shed a little bit, and that causes bleeding. If you've noticed you bleed during sex or after sex, it might be that you also experience an ectropion. A small amount of bleeding afterwards is normal, and needing to use a pad or something after it is entirely normal. If the bleeding is prolonged, so lasts longer than kind of into the next day, or it's very heavy, then you should seek medical support. But yeah, you can have sex afterwards. Just be aware that you might bleed a little bit. But I'm a big advocate for doing something after your smear test that feels like a reward and a treat. So if for you that's sex, then medically you can definitely go for it. The next question is a very similar one. It's about whether you can have your cervical screening during your period. Now, actually, it's advised to avoid booking your smear test over your period. The reason for that is the sample can be contaminated by the blood cells. So it's much easier to interpret the test and much more likely to be accurate if it isn't interfered with by blood. So if you can, try and time the test to be around your period. GP practices or wherever you go for your cervical screening are very understanding of this. So if you've got an appointment booked and you call up in the morning and say, I've come on my period, or I'm bleeding, I need to postpone it, please don't worry about wasting your appointment. They're very aware that, we can't always control our timings that well. Another question is about that someone who's not yet sexually active. So if I'm a virgin, can I still get a smear test or a cervical screening test, and will it take my virginity? Now, actually, anyone who is between the age category, so 25 to 64, will be invited for this screening test regardless of your sexual history or your sexual orientation. So even if you've never had sex before, you'll still be invited. And actually, the guidance is that you should still go. If you've completely had no sexual activity, meaning no sex, no oral sex, no sex with sex toys or anything like that, then the risk of having HPV is super low, and your individual case might be that you don't need to go for it, and you can chat with your own doctor about that. But in general, if you've had any kind of sexual skin-to-skin contact or used sex toys or anything like that, then you might still have HPV. And like I've said, the benefits of going for this test hugely outweigh not going for it. So the advice would be to still attend. Also on the the note of will it take your virginity? No, because whilst inserting a speculum is a medical procedure, it's not associated with sex or relationships. And virginity, the word virginity, is associated with having a sexual experience for the first time. So I wouldn't classify inserting a speculum to be in that same category at all. So even if you are a virgin, then you by all means please go for your smear test if you are within the age category. The next question, I love that someone's asked this because I know so many women worry about this. Do you need to shave for your cervical screening? Absolutely not. We are doctors or healthcare practitioners, and honestly, we don't care what you look like down below. I work actually in genitourinary oncology, but mainly kidney and bladder cancer, and I always have to insert catheters into patients. And so many patients are self-conscious about this. Honestly, to us, it's a medical procedure. If you want to shave because you shave and that's your personal preference, then by all means, that's fine. But you really don't need to prepare in any way for your test. We are really not looking at what you look like down below. We're just focused on doing the procedure accurately and in the most comfortable way for you. So please don't feel self-conscious about that. I honestly can't reiterate enough that we really don't care. Everyone looks different, and it's something that we're just so aware of. Okay. The next question, a great one with the theme of Pride Month this month. Do I need cervical screening if I'm in a lesbian relationship? So cervical screening is offered to women or any person with a cervix, regardless of sexual orientation. And although I mentioned HPV is more easily passed on through heterosexual intercourse, it can also be passed on through any form of sex, if that's heterosexual or not. So as with any other sexually transmitted infection, HPV is passed on through bodily fluids and skin-to-skin contact. This means it can be transferred through any form of sex, sharing sex toys, foreplay, any skin-to-skin contact. So actually studies have been done involving lesbian and bisexual women, and found that between 3 and 30% of the women in the study actually tested positive for HPV. So I would still encourage you to go to your smear test regardless of your sexual orientation. And on that note, the healthcare practitioner doing the test won't ask you, or shouldn't ask you, your sexual orientation during the procedure. They don't ask any questions like that. So please don't let that be a barrier. Speaking of barriers to accessing the cervical screening, someone's asked about if they are in a wheelchair, can they still have their screening done, and how will it happen? This is something that I am so passionate about, and I know the charity Joe's Cervical Cancer Trust have done a lot of research on this. The studies show and the stats show that women with physical disabilities are not properly represented by these screening tests, and the outcomes are worse. So there's many shortfallings for that. Thinking about my experience working in general practice, some of our GP surgeries don't even have wheelchair access to the surgery. So I really recognize, and I think people are increasingly recognize, that more needs to be done to advocate for people with physical disabilities. But yes, technically anyone with a physical disability should have the same access to cervical screening. The most important thing I would say is to ask for a double appointment, because it might take a bit longer to transfer you to the bed or to get assistance with doing the procedure, if that's not possible. So I also would suggest bringing someone with you if possible. But I think it's quite an individual case. And so maybe before the appointment, just sharing that you're concerned about it, or maybe you've had a previous bad experience, which is why you've asked this question with your practitioner. I think I can speak on behalf of most of my healthcare colleagues that individually, we really want to do a lot to advocate for you. So yes, it can still be done. We just need to make a few adjustments. The next one I've already asked about, can you put the speculum in yourself? Yes, absolutely. It's kind of common practice for your practitioner to do it for you, because they do it all the time and most people are fine with that. So if you want to do it yourself, just make that aware at the beginning. Otherwise, they'll probably rush ahead and do it. And they are trained to do it quite quickly and they know what they're looking for. But yes, absolutely, you can put it in yourself. What position is the test done in? So it's usually done where you lay on your back, you bring your knees up to your chest, and then you flop your legs out a bit like a frog position. It's the same position if you've had like a bikini wax or something like that. But if you have back pain, you might find that really uncomfortable. So you can actually have it done if you lay on your side. It's called the left lateral position. And you lay on your side and you tuck your knees up to your chest. They can also do it in that position. So if you find laying on your back uncomfortable, then you can ask for the alternative position. The next question is probably the most important question I'm going to answer on this talk. So if you zoned out, this is the one to listen to. It's, what do the results of the test mean? Now, if there's one thing, if I was in charge of a public health message, this is the thing I would do more public education on, is what the answers and the results mean when you get that letter in the post. Going for the smear test is one thing, but actually the anxiety of waiting for the results and understanding what they mean is another huge source of anxiety for many of us. On the letter that you receive with the results, it will tell you if your sample is HPV positive or HPV negative. I'll go through what it means if you're HPV positive first. If your samples are positive for HPV virus, it means that on that day you have the virus present. And as I mentioned to you before, most of us will get HPV at some point in our lives and we will clear it naturally. So just because you have a HPV positive test on that day of your smear test does not mean you're going to get cervical cancer. What it does mean is that we need to just be a bit more diligent. So they will then test your cells on that sample to see whether they're abnormal or not. If your cells are normal, so they look like healthy cervical cells, then nothing's wrong. What they will do is they'll invite you back in 1 year's time, so a bit earlier, and they'll test you for HPV again. So you'll have the cervical screening done again, and they'll test you for HPV. If you've cleared it, as many people will, that's fine. You'll be invited back to the routine recall of 3 and 5 years, depending on age and location. If the HPV is still positive, they'll test you again at 2 years to see if you're HPV positive. If you're negative, back to 3 years. If you're positive, they'll do it again the next year. So you have this yearly test to see if you've eradicated HPV from your body. And again, if you're still positive, they test the cells. If at 3 years you are still HPV positive, they'll do a procedure called a colposcopy where they'll look slightly more in depth at the cervix. And that's because, as I mentioned, most people clear the HPV virus naturally within a couple of years. If your cells are abnormal, then they'll invite you back to have a colposcopy. If they're not, you'll go back to the routine recall. If your results come back as negative for HPV right from the outset, then you'll just go back to the normal process of another smear test in 3 years or 5 years. Sometimes they invite you back in 3 months, and that's because the sample that was taken on the day isn't sufficient to adequately examine, so they need to take some more samples. So I hope that's clear. There's just a couple of questions that have come through about that. I'm going to just answer them. So Sarah said, I was never invited back after a year after I was positive. They told me to come back in 3 years, but I did have a colposcopy. So the reason that they didn't invite you back is likely because you had the colposcopy, which is the thing they normally do at 3 years. If you have an appointment booked for the next year, but you have a change in symptoms, can you ask for a test sooner? Absolutely. This is not a test for cervical cancer. So if you have any gynecological conditions, such as new pain during sex, new bleeding after sex, new bleeding between periods, any sort of vaginal bleeding, postmenopausal vaginal bleeding, abnormal discharge, change in smell, anything like that, then you should go to your doctor and have an examination to detect those symptoms. So yes, the answer is don't wait for your smear test. If you've got symptoms, please do seek out medical attention before. Is there an age where you stop being invited for smears? Yeah, so 65 is the age that we would stop inviting. The reason for that is that your risk of developing cervical cancer after that age massively reduces. It's likely that you've cleared the HPV virus. But like I mentioned, if postmenopausally or post 65 you develop any symptoms, then you will have the test done as part of the routine assessment of those symptoms. I'm going to get back to the questions that were submitted before, because I'm just aware we've got sort of 5-10 minutes left. So this one's about calming nerves. I think I mentioned that one before. I think for me, when I'm nervous about any medical procedure, educating myself on it is like the most empowering thing I can do. So have a read up about why you're having the test and what they exactly do and what the results mean and all of that, because I think when you have that awareness, you just feel more in control of what's happening to your body. I think many women just kind of get this letter, they go into the appointment not knowing what to expect. The practitioner does this every 5 minutes for the whole day, so they don't explain it to you that thoroughly, and then that just makes you super anxious. So along with all the things I mentioned at the beginning of the video, then definitely kind of reading up. This one is, I love this question. How likely are you to get HPV again if you've cleared it? Great question. So HPV does not come back once you've cleared it. Once your immune system has eradicated it from your body, they remember it. So even if you were to get exposed to that strain of HPV again, your immune system could fight it off and you would never know you've got it. But there are over 100 types of HPV, so 100 different strains. We know that some strains are more associated with cervical cancer. So the strains 16 and 18 are the most high risk for cancer, and they're the ones that we're vaccinated against when we're in school. But just because you've had one strain of HPV and cleared it, you might get exposed to another. So even if you've had a positive HPV result that turns negative, or even if you've had the vaccine for HPV when you were in school, I would still encourage you to go for your smear test because you are still at risk of all the other strains, unfortunately. As someone who is younger than 25, can we ask for a test if there's something we're concerned about? So if you are concerned because you have symptoms, then your doctor will likely do a test as part of that. But the smear test or the cervical screening program isn't offered to those younger than 25 because, as I mentioned, it takes sort of 5 to 7 years for abnormal cells to develop after exposure to HPV. So if you're sexually active in your late teens, then around 25 is when we would start to detect changes. The way we do screening programs is all kind of a population assessment where they weigh up the benefits of doing it to certain people, and doing it to people younger than 25 hasn't been shown to do benefit. But if you have symptoms or it's something you're particularly anxious about, then by all means go and ask your doctor to have an examination. I mentioned about bleeding after the smear and the scraping part. Let me see if there's any more questions in the chat. When I had my smear, they asked me to do height and weight. I already find the smear stressful. I just want to get out there. And this is actually makes me not want to go. Can you say no? Absolutely. So the way GP practices work is they have kind of targets to achieve about collecting data on their population. So you might notice that in any encounter with your GP, they might ask you questions that are kind of unrelated to that appointment, like height, weight, smoking history, when you last had an STI check. You can decline to answer those. The reason they're doing it is because they want to enter the data on the system, but you don't need your height and weight data to have a smear test or to interpret the results. So if you're someone that finds it triggering to be asked that, then by all means decline. And you could actually let the receptionist know on the outside, please, can I not be asked to answer these questions when I go in, and they'll send a notification to the doctor or nurse. So this question, they say you're okay because the HPV is negative or low, but does that mean you're safe from a cervical cancer perspective? So, and do they test for anything else during cervical screening? So they first of all test for HPV, and then only if positive do they test your cells, but they also are having a look at the general health of your cervix. So when they examine you, if you experience a lot of pain or your cervix doesn't look that healthy, then they will invite you back to have a further examination. If your HPV is low or not there, then you are safe in that moment from cervical cancer, because 99% of cervical cancers are caused by HPV virus. So if you don't have the virus, your chances of having cervical cancer develop for another reason is kind of less than 1%, probably even lower than that. So is there a way for people who are over 25 but living with parents or in ethnic households to ask for a smear but to keep it secret so patients don't assume sexual activity? So two things. Like I mentioned, this is a government screening program that's regardless of previous sexual activity. So first of all, I would maybe encourage the people in your household to be aware of that. And secondly, yes, it can be kept completely discreet. The letter will come to your household, but if you speak to your GP practice and say, I don't want letters to come, they can take you off that and you can just book in manually, or they can do a text message or something. But yeah, your medical records are completely private. I've had the same partner. Does that mean I won't get HPV again, or can I still get it regardless? That's a really interesting question. So I would say the chances of getting it again are low, but I would still go to your smear tests. like no one's really studied that. Humans are really unpredictable, so you couldn't do a study where you just got people to stay with the same sexual partner for the whole of the time of the study. So no one really knows. Just to be safe, I would still just go for your smear test. And do you think the age will ever be lowered? Probably not, just because the risk of cervical cancer is so low. I'm going to round up there. If there are any more questions, then by all means, feel free to message me on Instagram or comment on the latest reel that I just posted in collaboration with Fann Summers. It's live on both my page and Fann Summers' page. I'm happy to answer them. Can't give one-on-one medical advice, but I can give generic advice like this or direct you to some support services. I really hope that was useful. Thank you so much for being so engaging, sending your questions, and to Fann Summers for inviting me to collaborate on this. It's been a great campaign.